Angie Schiavone, and I'm with Full Circle Interpreting. I just wanted to make an announcement in Spanish so that all our Spanish-speaking folks can connect to interpreting services. We are going to be interpreting this whole session today so that people that speak Spanish can fully participate. Hola, muy buenos días a todos y todas. Queremos explicarles que sí estaremos ofreciendo servicios de interpretación simultánea. La forma de conectarse al servicio de interpretación es que en los controles de Zoom que aparecen en la parte de abajo de su pantalla, verá un símbolo redondo de un mundo. Presione ese botoncito y luego se puede ir para español. Si está utilizando una tableta o un teléfono, la forma de conectar a la interpretación es que abajo de su tableta o teléfono a mano derecha encontrarás 3 puntitos que dicen más o more. Presiona esos 3 puntitos, luego te vas a ir a Language Interpretation o interpretación de idioma, después eliges español y es importante poner el botón de finalizar o done para que comience a funcionar la interpretación. Cualquier pregunta nos dejan saber en el chat, por favor. Y les recordamos que no funciona a través de un Chromebook, así que deben conectarse con un teléfono inteligente regular o un computador. Gracias y que tengan una gran sesión. Back to you, Donald. I've gone ahead and made the announcement about interpreting services.
Thank you so much, Angie, for that. Again, thank you all for joining us for our last North Carolina Rural Coalition Fighting COVID meeting for 2021. The North Carolina Rural Coalition Fighting COVID-19 is comprised of leaders from all over the state, including the North Carolina Rural Center, Hometown Strong, the Governor's Office of Public Engagement, North Carolina AHEC, and the Foundation for Health Leadership and Innovation, who all partner with North Carolina Department of Health and Human Services Office of Rural Health to extend the Office of Rural Health's reach into rural communities across the state in terms of disseminating vital resources and messaging that can reach our rural communities. These meetings strive to unify and coordinate the many efforts to prevent COVID-19 in North Carolina's most vulnerable communities and really lessen the pandemic's impact on rural communities and in marginalized communities. Since February of this year, we've actually held more than 20 Rural Coalition meetings with over 800 individuals representing various organizations and sectors from all across the state. These meetings have featured conversations with individuals and organizations that are working directly on the ground to address the COVID-19 pandemic in rural communities and marginalized communities, as well as statewide leaders and subject matter experts who are providing us with the most up-to-date information and data on the virus, the state's response to the pandemic, as well as any emergent therapeutics. This week, we have the privilege of hearing from Dr. Betsy Tilson, who is the State Health Director and Chief Medical Officer for the North Carolina Department of Health and Human Services. Dr. Tilson will provide updates on the latest COVID-19 trends, variants, which I know we're all interested in, booster shots, as well as vaccinations for kids. While many of you know Dr. Tilson, I want to take just a few seconds to introduce her and share a little bit about her background and her experience. Dr. Tilson serves as the North Carolina Department of Health and Human Services State Health Director and Chief Medical Officer. In this role, she promotes public health and prevention activities, as well as provides guidance and oversight on a variety of cross-departmental issues, including the opioid epidemic, early childhood, Medicaid transformation, healthy opportunities, and of course, COVID-19. Dr. Tilson has a bachelor's degree in biology from Dartmouth College, a medical degree from Johns Hopkins University School of Medicine, and a master's degree in public administration from the University of North Carolina at Chapel Hill. She completed a pediatric residency at Johns Hopkins Hospital and a general preventive medicine and public health residency at the University of North Carolina at Chapel Hill. And she's also board certified in both fields. Before joining DHHS, Dr. Tilson was the medical director of community care of Wake and Johnson counties, one of 14 community care of North Carolina networks, and as the chief network clinical officer for CCNC. Prior roles have also included serving as an assistant consultant professor and cancer control specialist with Duke University Medical Center and a clinical pediatric fellow at the University of North Carolina at Chapel Hill. Dr. Tilson practiced primary care pediatrics for 26 years, primarily at her local health department, Wake County Human Services Child Health Clinic, and she's been active in many local, state, and national pediatric, public health, and preventive medicine organizations in which she has served in numerous leadership leadership roles. We're just super excited to have Dr. Tilson join us this morning to really share some updates and insights on the latest in terms of COVID-19. And without further ado, I'll turn it over to Dr. Tilson to start our conversation.
Wonderful, thank you. And I'm equally excited to be here and thank so many people for joining, and thank FHLI for really continuing to convene this incredibly important and robust coalition. So much of our state being rural, the opportunities and challenges and solutions sometimes are different in rural areas, and so really appreciate the importance of the work everybody does every day. So happy to be with you all. As Donald said, I will go through some of our trends, some updates on vaccines, a little bit on therapeutics and treatments as well. But just a little bit of heads up, I unfortunately have a very hard stop at about 9:57. We briefed the governor at 10 today, and I'm happy to say your governor is very prompt. And so a 10 o'clock briefing starts at 9:57. So I have that very hard stop, but I'm sure you understand that. So we're going to go ahead and I will share my screen, go through some slides, but we certainly should have time for questions that I don't answer as part of my slides. So let me go ahead and do this. There we go. Okay, Will, I see you on video. Can you nod to say if it looks okay? You can see my screen? All righty, perfect, wonderful. Okay, as I said, we'll do a little bit about the trends and data, and this is where we'll talk a little bit about what we know about Omicron. The biggest thing to know is we're still learning, and then vaccines and therapeutics, or some of our medications that are coming out. First thing is, I hope many of you follow along on our trends on our public dashboard. We've really tried to put so much robust information and data on our daily dashboards, updated every day about noon. You can see the link to the dashboard on the bottom left, but we've tried really hard to have our data be out there, transparent, available, so people can go and look at the trends every day. From the very beginning of the pandemic, we have identified 4 key metrics that we look at to gauge what is going on across the state. No one metric is perfect, which is why we put these 4 key metrics together to give us a pretty good sense. One of our key metrics is people being hospitalized for COVID. And then we have 2 metrics that are having to do with cases and diagnosed cases. The bottom left is the people who have been diagnosed with new cases per day. The top right is the percent of all of our tests for COVID that are positive. And then the bottom right are people that are coming to the emergency department for COVID-like illness. They all look at something slightly different, but the composite can give us an idea of what is going on across the state. And unfortunately, despite a really nice decline through October and November, we are now starting to see a rise in all 4 of our key metrics again. This is not unexpected. We thought this would happen as we head into the winter months. We head into the holiday season. This COVID is a respiratory virus, like many of our other respiratory viruses. We do start seeing what we call a seasonality, that things spread more easily in the winter, likely a combination of colder, drier weather, people coming more indoors, and people gathering more. So we are starting to see this increase again in all 4 of our key metrics. On the next slide, I'll show you in graphical, but one thing let's say is that right now, the increases in cases that we are seeing is all Delta still. Well, 99% Delta still, and I will show you that. But we do have our eye on Omicron. As many of you know, it is rapidly spreading across the globe and in the United States. And as of Friday, last Friday was the first documented Omicron variant in North Carolina, in the Mecklenburg area. It is likely in other places in North Carolina, but just circulating at still such a low level that we aren't able to pick it up yet. But we do expect it will be, again, it has already been introduced in North Carolina. We do expect that it will start to spread in North Carolina. It's hard to predict exactly when, but our estimates, looking at what's happened in Europe and in England, is that it may be mid-January or so where we see that it may start taking over the other variant. But right now, it is all Delta. What we're learning about Omicron, and again, we still have a lot to learn, but early data out of South Africa, which is where it was first identified, and then out of the UK, where it has been spreading pretty rapidly. What we are learning is that it will likely outcompete Delta, and it likely because of increased transmissibility or increased contagiousness. Now remember, Delta was already more transmissible or more contagious than prior variants, and it looks like Omicron will be even more transmissible than Delta. Some things that we are learning, again, still early information, we're going to need to learn more, but from early in data, what we are learning is that although past infection may give you some protection against Delta and other variants, what we are finding is past infection will probably give you even less protection against reinfection with Omicron. But what some of the early data is showing that if you have vaccination after a natural infection, that will likely bolster protection against Omicron. What we are learning is that the primary series, so either the 1 dose of J&J or 2 doses of Pfizer and Moderna, although it still will likely provide pretty good protection against severe illness, hospitalizations, and death, maybe about in the 75% range, it is likely not to provide as much protection for infection. But the good news is what we are learning is that boosters likely will really ramp up that protection, not just for infection, but also increase even more the protection against severe illness and death and hospitalizations. What we are learning is that we have a certain type of medication, we'll get to that a little bit later, called monoclonal antibodies. There are 3 different types that we have in North Carolina. Unfortunately, it looks like 2 of those types may not be effective against Omicron, and one of those types, which the term is sotrovimab, may still retain efficacy or still be able to use for treatment. So that's the good news. We'll talk a little about this later. The bad news about that one is that medication you have to administer by an IV infusion. It's a little bit more complicated as opposed to just the shot, which some of the other ones have been given, and that makes it a little bit more accessible, especially for people in rural areas that may not have access to an IV infusion place. So we are looking carefully at that and the impact of treatment. And then we have some other medications that could be used for treatment, and we still are learning about the effectiveness of those treatments on Omicron. So big take home is we expect that it will spread pretty quickly. Already is here. We will likely see more and more of it in January. Really, really, really important pieces, though, are that everybody who is not vaccinated should get their primary series. And then really important is that this is the time to get boosters for people who have had their primary series, really need their booster. A, it'll protect them against Delta, and B, likely protect them against Omicron. So now is the time to get those boosters in so that when we have Omicron, that we have the biggest amount of protection for people. Next slide. This just looks at what variant we have circulating. Again, this is also on our dashboard and our weekly surveillance report if you want to follow along to see what variants are here. The red is Delta. And we still, again, have about 99% of what's circulating in North Carolina is still Delta. So we still have lots of great opportunity for people to get vaccinated, people to get boosted. We know that's effective against Delta, and then time to prepare for Omicron by getting people vaccinated and boosted. The other piece that I want to raise for awareness is, again, not only are we having increased transmission because of Delta because of the winter, the potential of the introduction of Omicron, but we also are starting to see flu. Last year, we saw almost no flu just because of our pretty strict public health mitigation strategies. We have lightened up that this year because we have other tools, and that's good. We want people to get back to all their parts of society, but that means things that circulate when people circulate will start circulating, including flu. So we are already starting to see flu circulate in North Carolina. On the left-hand side of the slide, this looks at all of our different respiratory viruses that circulate. That dark blue line, that's higher than everything else, that's still COVID. But if you look at the top left, where it's a call out of the most recent trends, what you'll see is the green on the line. The green is flu, and we're starting to see that tick up. We also, the yellow line, FYI, if anybody's had a kind of a cold or been sick over the past couple of months, you tested negative for COVID-19, you likely had rhinovirus. That's what's that's our other respiratory virus that's circulating around. So that's in the yellow line. But what we're tracking pretty closely is that green line, which is flu, and we're starting to see that uptick. On the right-hand side, you'll see the cases. We test for flu in our state lab public health, that's SLPH, that's our public health lab. And also we have a network of hospitals that test flu for us as well. And so we get samples from there. So we are starting to see flu across the state. Couple other things about flu to make you aware. What we are finding is the strain of flu that is looking to circulate, which is called H3N2, has been associated with more severe illness than other strains of flu. And unfortunately, we have just reported our first flu death in North Carolina as well. So I just want to be sure, sometimes we forget about flu. I want to be sure this is on everybody's radar, that flu is coming. Typically in North Carolina with flu, we don't peak until the end of January, beginning of February, so we still have time to prepare, but really important to also encourage flu vaccine as well. One, to protect the person from, again, either a more severe flu illness or having COVID and flu at the same time, but also to preserve our healthcare capacity, because in a regular flu season, our healthcare capacity is pretty strained with people with flu. And if we have COVID and flu, that's really, really, really going to affect our healthcare providers to be able to care for people. So really important to think about flu and encouraging COVID vaccines, boosters, and flu vaccine. Okay, talking about vaccines, let's talk a little bit about where we are. So first, I want to say that happy Vaxiversary, as we've been saying yesterday, but yesterday marked 1 year from the first COVID vaccine that was administered in North Carolina. And so we have come a long way in 1 year, but this is yesterday was our 1 year of the first dose administered in North Carolina. And I don't know if you remember that day. I remember where I was, that we had just struggled through almost a year of not really being able to provide protection for people. People were living in fear. You could feel the stress. And knowing that we had vaccinations, it was a huge sigh of relief. There were tears. People finally had something they could do to protect themselves and their loved ones. And we've made a huge progress in that past year. So these are some of our numbers. Overall, we have administered more than 14 million doses just in North Carolina in 1 year. And that really is thanks to so many partners, all of you, so many of our healthcare providers, so many of our community providers, huge team effort. 14 million doses have been administered. That is more than 62% of our total population. But remember, our youngest children aren't even eligible for a vaccine yet. And then our 5 to 11s just became eligible just a couple weeks ago. And you can see overall for adults, about 73% of our adults have had at least one dose, and really high uptake in our older people, 65 and over, which is really important because those folks are at the highest risk of death and severe illness. So you can see that on the bottom left. On the right-hand side on the bottom, you can see the number of doses and the percent of the population that is vaccinated by age group. I want to just call attention to the pediatric age group since these are relatively new. Almost half, about 46% of our older teens, 12 to 17, have had vaccination. And then 17% of our 5 to 11 have had at least one dose. And again, that group was just eligible just a couple weeks ago. Couple more things about boosters. You heard me, boosters are really important. As of last week, there was an extension of authorization for boosters down to age 16. So now everybody 16 and older It is recommended that they get boosters, and it is authorized that they get boosters. For our people 18 and up, they can get boosted with any 3 of our vaccines. For people 16 and 17, it is only Pfizer that is available for those 16 and 17-year-olds. With boosters, are early, you can mix and match. You do not have to get a booster of the same vaccine that you got your primary series in. And some preliminary data has showed us that getting a booster with either Pfizer and Moderna looks like it gives you more of an immune boost than a booster with Johnson & Johnson. And so we want to be sure people are aware of that as they're making a choice. And if a person got Johnson & Johnson as their first dose, it does look like you get more of an immune boost if you boost with Pfizer and Moderna. And just as a reminder, the timing of a booster for people that got Pfizer and Moderna, they're eligible for a booster or can get a booster 6 months after their second dose. For people that got Johnson & Johnson, it's recommended they get a booster 2 months after that first dose.
Dr. Tilson, if you wouldn't mind me just interjecting for a second, we had a question in the chat related to flu and COVID vaccinations. So the question says, can people get flu and COVID vaccinations at the same time, or do they need to space out those vaccinations?
That is a great question. Thank you for asking. You can absolutely get it at the same time. We highly recommend it. Go get both of them done at the same time. And you could also get your shingles vaccine or your pneumococcus vaccine. You can get your COVID vaccine at the same time as any other vaccine, or no, it doesn't matter any of the spacing, timing of any other vaccines. But I would absolutely go ahead and just get them both done at the same time. Okay. Should I go on, or are there other questions you want me to stop and do now?
You can continue. We just had that one question that was relevant.
Okay, that's great. Yeah, and feel free to interrupt as well. Okay, just drill into a little bit more about pediatric vaccines. As again, our kids 12 and up, they've been eligible for a vaccine for a while now. The Pfizer, though, vaccine is the only one that is available for people under 18. I alluded to this with the booster data, but for primary series, just Pfizer is available for everybody 12 and up. So we're excited about that. I want to be sure that people are aware of that and encouraging that. Now with our 5 to 11, again, those folks became eligible just a couple of weeks ago. And so we're really, really excited. We know so many parents were eagerly awaiting this. I'm very excited to be able to offer this protection for their children. Couple things to know about COVID and children. So one, in the beginning, we really were learning more and more about COVID and how it might affect children. There was some early data to show that, well, maybe children aren't susceptible to COVID. But as we have learned and gone along, we have learned that yes, children can absolutely get COVID-19 virus just like everybody else. Some children are experiencing long-term side effects. And this is really a known unknown. We really don't have long-term data about how much, even with a mild infection, what might be some of those long-term effects on children of COVID-19. This is a known unknown. We saw with that big Delta surge that we saw in that late summer, early fall, that it was our pediatric population for the first time ever in the pandemic. Our pediatric population had the highest rates of infections with Delta. So a big surge really affected our kids. And, you know, they are back in school now, and we really want them in school. We 100% want them in school. But offering that vaccination is a really nice way to protect them and lower their risk while they're back in school, and then getting back to the places and all the things that they love. Couple really nice things about vaccines. One, already it decreases their risk of getting the infection, which is great. But it also, and this is a really important piece, is if they have a close contact or exposed to somebody with COVID-19, if they are fully vaccinated themselves, they don't have to quarantine. And we know that quarantine is a huge issue. So they don't have to quarantine. They don't have to miss school. They don't have to miss sports. They don't have to miss any of those really, really important life-enriching activities if they are fully vaccinated. So that is a really huge benefit of getting fully vaccinated, on top of the primary benefit of protecting you from getting infections. Just just a little bit of the data from the clinical trials, specifically to our 5 to 11 year olds. The really nice piece of these vaccine trials is one, certainly we have a huge amount of data on our adults and on our adolescents. So we have a lot of that data on which then we can also add data specific to the 5 to 11 year olds. The really nice piece in these clinical trials that there was no serious safety concerns or serious side effects in the clinical trials with the 5 to 11 year old. Children had a really, really nice, robust immune response. More than 90% effective in preventing COVID-19, which is great. Thousands of kids enrolled in these trials with a nice mix of diversity around race, ethnicity, as well as children with underlying health conditions that might make them at higher risk for severe complications. Children, it is recommended they have 2 doses, just like adults or older adolescents. But a really important thing to understand for the pediatric vaccine 5 to 11 is that it is 1/3 the dose of the adult dose. So really important to know that 1/3 the dose, so that as parents are looking for a vaccine for their children, they need to be sure they're looking for someone that has the pediatric dose, which is, again, 1/3 of the adult dose. And on our MySpot .gov.nc, you can search for vaccine providers, and you can search specifically for those who have the pediatric formulation. So just want to be sure people are aware that you need to have the lower dose one for kids, and still 21 days apart, just like for older people. What we find, kids pretty much have the same type of temporary side effects that we see in older people: sore arms, headache, achy, those kind of things. People can take ibuprofen or Tylenol to help with the temporary reactions. We haven't seen any major differences in kids as opposed to, again, our older adolescents or our adults. Now, I know people have heard about this risk of myocarditis, which is a temporary inflammation of the heart muscle. We have seen some of that in our young adults and our older adolescents. One thing I would say, a couple things, is that in general, myocarditis is more likely in young adults and older adolescents normally. That is just the age range that we see myocarditis generally. Second thing to say is people have a higher risk of myocarditis with the actual infection of COVID-19 than the risk of the vaccine. And third, in our younger, the rates of myocarditis are more in our older adolescents and our young adults than it is in our younger adolescents, so less likely in our 12 to 15 as opposed to our 16 and up. And again, just because that's in general where we see myocarditis. In the clinical trials, there were no cases of myocarditis in the younger children. And that may well hold true because, one, again, it's 1/3 of a dose than the older kids. And again, myocarditis overall is just much less likely in these younger kids. So we'll be following that very, very carefully. But I know people had concerns about that. So just want to be sure you know there were no cases of myocarditis. Children of this age are at lower risk anyways, and it's 1/3 of the dose. But we'll be following that carefully. And that's on the robust ongoing safety surveillance. Okay, just a little bit about some nuts and bolts about vaccination, which I hope you all know, because a lot of this is similar to our regular nuts and bolts. But one, as I've been alluding to, it's only Pfizer that is authorized for the younger kids. So we want to make sure you're looking for Pfizer, and then specifically that smaller dose. We have lots of availability across the state. Supply is not a problem. More than 800 locations, and you can find it on our website. It is free. The pediatric vaccine is free, just like the older vaccines. You do not need proof of insurance or citizenship. But for this pediatric vaccine, written parental consent is required for these younger pediatric vaccines. It is administered in the upper arm, just like the older vaccines, but for some kids, if that doesn't work, you can administer it into the muscle up the upper leg, if that is better for the individual child. And again, to answer the question, yes, you can give COVID vaccine at the same time as any other vaccines, including flu vaccine, and we encourage that. Couple other things. One thing that we really heard loud and clear from parents is that they wanted to get their child vaccinated in a trusted healthcare setting, that they had a relationship with a pediatrician, family medicine in the primary care medical home. Parents are comfortable with and want to get the vaccine in there. So we've been doing a lot of work in recruiting our primary care providers. That's what PCP says. So our primary care providers, our pediatricians, family medicine, to be sure they're enrolled and able to give vaccine. And you can see week by week increasing number of our primary care providers. So almost 950 of our primary care providers have the vaccine, so people can go to their regular medical home to get the vaccine if they prefer or are comfortable with that. The other place we're trying to make sure vaccine is available is through our family vaccination centers. These are our community-based vaccination centers that have been doing vaccination all along, but with the family centers, now they have vaccines for adults, either primary series or the boosters, as well as the pediatric vaccine as well. So families can come in and all members of the family can get what they need at these family center sites. They're accessible to our communities. We've tried to strategically make sure they're accessible and comfortable for historically marginalized populations, and really try to reduce barriers as much as possible. And these vaccination centers have been very, very, very successful, especially with our equity lens. We have lots of material on our website, especially around information on children. You can see that website there. We really encourage you to come, take any of our resources, brand them if you want, distribute it through all of our stakeholders. We have them in English and Spanish. So please, please, please come to our site, use whatever material you want. Please help us to promote the message and share as you can through your networks.
Dr. Tilson, we have another question in the chat related to booster recommendations for adolescents 12 to 16. Is there any idea or information about the possibility of boosters for that age group?
Oh, forgive me, I thought I answered that. Yes, so everybody 16 and over are eligible for boosters, recommended and eligible for a booster. The age of boosters down to 16 happened at least last week, if not the week before. So everybody 16 and up is eligible for a booster.
And the question just wanted to know any thoughts about if boosters will become available for those that are under 16.
Oh, under 16, forgive me. Well, we need to follow the data on that one. Remember, the under 16, the 12 to 17 were authorized after. So we'll need to look at that data in that age group. And then once there is sufficient data, then a recommendation could be made. So we'll need to wait more on that age group. Again, just because that authorization came after the older, it just takes more time to have the data. But I anticipate, as we have the data, that if the data supports it, that they may well be authorized and recommended for the younger age group. We just have to wait on that.
Okay, thank you.
Okay, great. Just a couple other things. One, I'm just really proud of you all, of all of our providers of North Carolina. This looks at our pediatric vaccination rates, and we are doing the best in the Southeast. Is what's called our Region 4, which is all of our Southeastern states, and we have the highest rate of vaccinations amongst all of our peers. So we're very excited about that. We want to keep going. We do think a big part of this is our really robust participation in our primary care practices in those trusted medical homes. All right, a little bit about holiday messaging. So I keep saying, ooh, we're heading into the winter. We're seeing uptick in our Delta, we may have Omicron, and we have flu. So how do we protect our people? We have updated a lot of our holiday messaging, our winter messaging, what people need to do. These are all updated and posted as of yesterday afternoon. These are all hot links, and I'm happy to share this the deck with you so you can get to the hot links. The big take homes are vaccinate, meaning primary series, booster, and flu. Test before you are gathering with people. If you're having holiday gatherings, go ahead and get tested before you gather. And then make sure you're wearing a mask in public indoor settings. Those are the three big things, and our updated guidances, which please look and share that widely.
I'm looking forward.
There we go. Okay, and then just two more things on therapeutics, and then I'll stop. couple things I alluded to, that we have monoclonal antibodies. This is a therapeutic where it's the antibodies that one would make if as part of vaccination, that the antibodies are actually made in the laboratory. And so that infusion or the injection of these antibodies can be given to somebody once they have the infection to really jumpstart that immune reaction and jumpstart that protection, and have those antibodies fight off the virus, just like natural antibodies made from either vaccine would fight them off. So we have this treatment is available. It is authorized for anybody 12 and up that have they've been diagnosed with COVID, and within 10 days of their symptoms, they're eligible for treatment. We have a call center that people can call to find out where monoclonal antibodies are available. We have on our website also a place you can search for antibodies available. And we also are working a lot with our testing providers, that if somebody tests positive, they can go ahead and give them information on available treatment as well. Because we do need to be sure that people get in within 10 days of their symptoms. So I want to make sure that people know that this is available. And again, all of these monoclonal antibodies are effective against Delta, which is the one that is circulating now. We have 2 more therapeutics coming down the pike, just to have awareness. And maybe you've heard about this in the news. One is an AstraZeneca product called Ebu Shield. This is a therapeutic that is given to people who either have a severe immunocompromise, they may not be able to mount a response from vaccination, or they have a contraindication to the vaccine, like, for example, a severe allergic reaction. This medicine can be given as an injection every 6 months to these very high-risk people. This was just authorized on the 8th. We expect to have this medicine in a very, very, very low supply, maybe within the next 2 weeks in North Carolina. And we will be specifically, with the small supply, be working with our providers that care for our very, very high-risk people. So people like that have an organ transplant, or they're in cancer therapy. So with our small supply, we'll be working with these these providers that care for our very high-risk patients. You may have also heard there's also a pill, a Merck pill, that can be taken as after you have a diagnosis for early treatment. This pill has to be taken within 5 days of symptom onset, and there are some clinical decisions that have to be made whether or not this medicine is appropriate for a person, including there's concerns of pregnant women taking this medication. So it is likely that there'll need to be a pregnancy test and just a fair amount of clinical considerations for this pill. We anticipate that the FDA may authorize this as soon as Friday, and we may have a very small amount of this medicine starting the week of December. So we're working now with providers who are able to do that clinical assessment, can do a pregnancy test, and dispense that medicine all in one, since we have a very, very, very short window within 5 days to get that all done. So we are looking for those providers that can do that. We also want to make sure we're looking for providers where there is no, perhaps any monoclonal body access coverage, so we can make sure that people across the state have access to some therapeutics. So, for example, a federally qualified health center that has integrated pharmacies and clinicians and has nice reach. Those are some of the providers that we'll be looking for to get this initial dose of this medication out. So we'll be working on that and expanding those more and more as we have more supply in the year. We'll be getting, just again, very small supply near the end of this year. And that is it. So happy to take whatever other questions that didn't come up in the chat. I'm going to stop sharing my screen so that we can see each other, and we can go from there.
All righty. Thank you so much, Dr. Tilson, for that great information. I think that's going to be super helpful to members of this coalition as they go out in their communities and do the great work of responding to COVID-19. I want to start with just one question before we jump into questions from our audience. So Secretary Cohen announced, I think it was yesterday, that North Carolina is back in the red zone. So could you tell us, what does that mean for our state, and what does that mean for our communities, particularly our rural and marginalized communities?
Sure thing. And that red zone, again, that's when we look at those 4 key metrics, the red zone is a composite of 2, looking at our daily number of cases diagnosed and our percent positive. So those 2. And we are back up again in the red zone, which means, and this is what I was talking about in that first slide, that all of our key metrics are up. We're seeing more viral transmission up. And again, likely as we are heading into the winter, we're expecting it, and it is still all Delta now. So everything that I was talking about, it's the same tools. It is now we need to apply all those tools that are available, right? And so those are the key messages as we head into the winter. Is we don't have new tools. We just want to be sure everybody who's eligible for a vaccine, go ahead and get that primary series, and then especially get boosted. And then again, before we gather, vaccinated or not, doing a test before you gather, because we know vaccine isn't perfect, and making sure that we continue to wear face coverings, especially when we're in indoor public settings. All of those recommendations that we've been saying, now we really need to apply it. And especially the booster piece, we need to apply that because, again, with knowing that Omicron is likely going to be here, and it does look like the booster does give protection against Omicron. So that's another added layer.
Great, thank you.
Yeah.
We have a couple of questions in the chat. So one of the first questions is, how much hesitancy are you seeing, not only from parents of children 5 to 11, but from pediatricians and other healthcare professionals? And then how do we overcome that hesitancy that may be communicated by some members from our medical community?
A couple things. So we've done a fair amount of market research, especially with our parents. And what we are learning, about 60% of parents have said that they intend to get their child vaccinated. And so you can see we're already, I think it was up to 17%. So the majority of parents are intending to get their child vaccinated. So that's the good news. And then I think what we learned, even with adults, as people have had more and more experience with the vaccine, more and more people have become vaccinated. And so with our adults, we've just seen an uptick of more and more. So I think with our families as well, what they'll see is, so the initial 60% who want it have already decided, get vaccinated. And then the other 40%, I think, will learn from the positive experience of those who have had their children vaccinated, will get more comfortable with it as we go forward. So in most of our parents, it's not a hard no. It's just like, I want to wait a little bit and let me see. And so I think, again, as we have more and more experience and positive experience with the pediatric vaccine, just like the adult vaccine, that people will be more comfortable with it. A couple other things that when I've asked this question is, one thing is we really want to be sure that families and healthcare providers are getting accurate information. There is so much misinformation out on social media, and my biggest concern is that people are making a decision based on misinformation and not accurate information. So really want to be sure that we're directing people back to our website. Again, we had all that. We have a whole site just on pediatric vaccines with all of our FAQs, all accurate information. CDC has really great information as well. So base a decision on accurate information. The majority of parents say they're already going to do it. And then again, I think we'll see more and more people being comfortable with it when they see the positive experience of other people. The other thing is, there's only so much, there's different influencers across different groups. And you all listening are influencers, right? And you are influencers with your own group. So as you go ahead and get vaccinated, get boosted, or get your child vaccinated, please share your story. And we do have things on our website as well where you can do your own, your own tweet or your own picture, your own selfie. Share your message, share your experience, because what we are learning is that people are looking to their peers and their trusted source of what was your experience. So please use your voice, use your power, be the influencer you are, and share your own positive experience with vaccines and the reasons why you did it. Oh, you're muted again.
Thank you. We have a question about monoclonal antibody treatment and if a doctor's order is required for this to be administered.
So we have a statewide standing order that's executed under my name. So you do need to be referred to a site that has it, but there is a standing order already that I have written that can authorize it. But you do need to be referred to a site that has the medicine. But there is a statewide standing order covered by me.
Right. And just to stay on the topic of therapeutics or treatments, you mentioned that there's a development of a COVID pill that could be used to treat COVID-19. There's a lot of conversation in the community about whether it's necessary to get vaccinated when you have the development of a pill. Could you talk a little bit about the importance of still being vaccinated, even with the availability of emergent therapeutics?
Absolutely. And I really think about it as layered prevention, right? There is no one layer that's perfect, right? Masks aren't perfect. Vaccines aren't perfect. Treatment isn't perfect. We want to layer as many protective factors around a person as much as possible. So treatment won't take the place of vaccine. We want layered all of that. The other piece is, again, with treatment. So for example, the Merck Pill. Right? There will be some pretty clinical complexity there. So you have to be diagnosed. You have to get the medicine within 5 days. There needs to be clinical assessment. You can't be pregnant. And we have very little accessibility of that. So it is a great tool. It is another tool in our toolkit. It's another arrow in our quiver, but it won't be a panacea. So we want to be sure people are doing everything they can do all along the way to protect themselves and their loved ones.
All right. Do we have any other questions from our attendees? And again, feel free to raise your hand so that we can call on you to ask your question yourself, or you can drop it in the chat. All right, while we're waiting on additional questions, I do have one that I would like to pose to you. And this is something that you cover in your presentation, but I think is worth repeating. We're heading into the holiday season. We know that a lot of families are going to gather, and we want to be sure that we're protecting ourselves and our family members. So what is the state's recommendation as families prepare to gather and celebrate the holiday season?
And again, we have those updated guidance just posted yesterday. Donald, I will ask you and or Carla, I see you there, or Will, I see all my FHLI friends. Yay! Let's make sure we have that hot link that you're pushing that out. Specifically, we updated it. So the three big things are, as we head into winter and we head into gatherings, 1, make sure everybody is vaccinated, primary series, booster, and flu, number 1. 2, go ahead and test. Vaccinated or not, get a test before you gather, because we know vaccines aren't perfect. Go ahead and get a test before you gather. And then 3, especially if you're in a public indoor setting, go ahead and wear a mask. And I'll say, so this afternoon, some of the senior leadership of HHS, we are gathering for a holiday gathering. 1, we know we're all 100% vaccinated and boosted. 2, we all have to show our negative COVID test. I got mine last night. And 3, we will be masked unless we are actively eating and drinking. So those 3 things together, we can, and you know, the hardest part, there's many hard parts about this pandemic, but humans, we are very social creatures. And it is so important for us to have that human connection. The holiday season last year was so hard because people couldn't have that connection. So people can have that connection, they can gather. It is so important for our soul, for our mental illness, for our resiliency. Human connection is so important. So we can do that this year, yay, because we have so many more tools that we can use to lower the risk when we gather. And that's what we didn't have last year. So we can do it. We can gather safely, but we got to do it with those 3 tools: vaccinate, get a test before you gather, and wear a mask unless you're actively eating and drinking.
All righty. I think that's a great way to end this conversation. So I just want to thank you, Dr. Tilson, for an amazing presentation, as well as taking questions from the attendees at today's meeting. It's extremely important that we are armed with accurate information in order to combat the virus and its spread in our communities. And we're just thankful for your leadership and want you to know that you're always welcome here at the Rural Coalition Fighting COVID. And we would love to have you back sometime in the new year as there are more developments. So again, thank you. We want to be sure you can hop on your meeting with Governor Cooper. I think it's 9:56, and we don't want you to be late to
There
that.
you go. Well, thank you. And I really, really appreciate your leadership. This is so important. I'm very grateful to have me, and yeah, happy to join you anytime. So thank you for your leadership and all of FHI's leadership. It's just been a great partnership with you all. So thank you.
All right. Happy holidays. So, all right. And then I just want to finally thank all of you who are in attendance today. Thank you for joining us for our last Rural Coalition Fighting COVID meeting for 2021. We're excited about the participation we've had over the last year. As I mentioned at the top of the program, we've had more than 20 meetings with over 800 attendees across the state, representing community, representing providers, representing statewide organizations. And it really is this type of collaborative work that is going to help us move the needle and improve health outcomes in rural and marginalized communities. I just want to share a little information with you about 3 new work groups that we have formed. So we have a health equity work group, a behavioral health work group, and a North Carolina Rural Coalition Fighting COVID work group. And these work groups were really formed to bring together community members to develop strategies to address COVID-19, but beyond COVID-19 to really begin to lay a foundation for communities to improve health outcomes, specifically with a focus on rural and marginalized communities. I shared my screen earlier, and I'll share it again. Here's some information about those work groups. Each of them have had their first meeting and will have their next meetings in January. January 5th will be the next meeting of the Health Equity Work Group, which is led by Bridget Lucky from Vidant. Dr. Amelia Muse of the Foundation is the chair of our Behavioral Health Work Group, which meets on January 7th of next year. And then I'll be chairing our Rural Coalition Fighting COVID Work Group, and our next meeting will be January 12th. All of this information is available on our website. You can visit bit.ly /Rural Fights COVID, where you can see recording of today's meeting. We'll make sure we get the slide deck from Dr. Tilson, and that will be posted on our website. But also you'll have information about our our work groups, as well as other information of the Rural Coalition Fighting COVID. So again, thank you to all of our partners. We could not have done this without you over the last year. Happy holidays to everyone. And I just ask that you all please remember the updated guidance that Dr. Tilson shared with us as we prepare to gather with our family and friends over the holiday season. And we look forward to seeing you in the new year. So thank you all, everyone, and have a great rest of the day.